Hello and welcome to today's episode of the Nurture Pod. Today we are talking about low libido. We are doing this for two reasons. One, it's because it's a very common question that comes my way, especially with my interest in treating individuals with penetrative pain. And oftentimes these individuals experience a decreased libido or a decreased motivation to engage in intimacy or intercourse with a partner because of their history of pain. So thus the question of libido often comes up and how one can move past it. Secondly, in light of our season sponsor, which was guided by Glow. So let's for one last time listen to all that they have to offer in my most sensuous voice that I could possibly muster up.
But first, one of the most common questions that comes my way is how to have better and more satisfying sex. Although this is multifactorial, I so value the potential of erotic audio content to pique mind and body arousal. The audio app Guided by Glow aims to do just that. Their guided sexual meditation journeys gives you the space to slow down, relax, and connect you to your senses, your creativity, and of course, nurture your relationship to pleasure as you drop deeply inside the feeling body. Listen until the end of today's episode for a special gift from Guided by Glow.
I have a desire to increase comfort and confidence in conversations and normalize the narrative about topics that contribute to our comprehensive health and well-being. So let's talk low libido. First and foremost, let's cover what's important, and that is you are not alone. In a 2016 meta-analysis, their research suggested that 40.9%, let's call it 41%, of individuals that are premenopausal women, as according to how they identified in that study, worldwide experienced at least one type of sexual dysfunction. Let me repeat, 41% of premenopausal women worldwide experience at least one type of sexual dysfunction. That is a lot of individuals around the world. So you, my friend, are not alone. I hope that this gives you the sense of community as we lean into this topic and break down the taboo and the stigma that is associated with it and has potentially stopped you from seeking help. So on the topic of seeking help, my next important point is that this is not personalized care. This is for information sharing purposes only. I encourage you to seek the help of a professional. I, in fact, have been so lucky to work with incredible individuals and have been exposed to amazing research and books and podcasts that are out there for you too, so that you can learn a little bit more about this. But before I go on too much of a tangent, there are amazing professionals out there that are dedicated to knowing and understanding and serving individuals that are struggling with any level of sexual dysfunction. So please seek their help. They are there for you. I never want you to feel as though a healthcare provider is brushing your symptoms aside or telling you that it's just in your head. So because this is still a relatively new and still unfortunately taboo topic for a few people, I'm going to ask you to advocate for yourself. And if you have been told to suck it up and have a glass of wine and just get on with it, please find someone that has your sexual health and well-being at the top of their priority list when they're sitting with you as your provider. Okay, so let's get into it. You've heard me say low libido about 20 times already, but that's not actually the term that we use. It's the most commonly known and understood term, but it was actually more appropriately termed hyperactive sexual desire disorder, HSDD, But we don't even use that anymore. As research in this field is growing, we are broadening our horizons and learning more and more, and alongside that, really just identifying the appropriate terminology to use. So HSDD was thought to be a little bit too pathologizing, especially with regards to the term or the concept of desire. And that is, desire is, it's contextual. So what is a normal desire? What are we kind of striving for with treating HSDD if desire is personalized, and it's dependent on many factors, and what is normal anyway? So thus FSIAD was born and spoken about in DSM-5. So that is female sexual interest and arousal disorder. So next I'm going to go into a little bit of detail about how one would kind of fall into this classification of FSIAD. And this is by no means a Google kind of self-diagnosis protocol to follow. It's just information sharing and potentially giving you cues or points to speak about with a healthcare provider. So if you were to go and sit with a doctor and say, my concern is FSIAD, never mind, you would most likely rather say, I feel like I've got low libido or no motivation to engage in intimacy. A few things that your professional will be taking note of would be the following. There are 6 of them. Okay, so we're going to go through them now. We've got reduced or no interest in sex, few or no thoughts about sex, decreased sexual arousal or pleasure during sexual activity, reduced or no arousal in response to visual, written, or verbal cues, infrequent or no initiation of sexual activity within a relationship, reduced or no sensation in the genitals. So when creating or when formulating this classification, one would have to have at least 3 of these for 6 months or more. And along with that, they would also have to have significant distress. So I'm going to pause here and kind of go into this a little bit more, because you might have all of those. You might have one of those and have varying levels of distress. If there is no distress, that does not mean that it's a problem. It means that you are not distressed about such symptoms, and it might be that you're in a certain phase of life or you have a specific orientation. So if we speak about asexuality, so this is not a medical diagnosis, it's an orientation, but these individuals would not be distressed by a preference for a non-sexual relationship. That doesn't mean that they're broken. It means that that's their preference, their orientation, and that they are not distressed by it. So don't be too kind of alarmed about that need to have distress, or that point of having distress with regards to FSIAD. So when chatting to your doctor, kind of turning back from our tangent there, when chatting to your doctor, they would also consider things such as your mental health, any medication that you're using, any hormonal changes, any substance abuse, because those can all weigh in to one's experience of having, inverted commas, low libido, which is why I say that this is not a self-diagnosis, and that you must absolutely work with professionals when you are experiencing concerns with regards to your sexual health and well-being. With having low libido, you might have noticed, or this might pique your interest, that it might be situational. It might only be with certain partners. It might only be when you're on holiday, or it might only be when you're not on holiday. But it can also be generalized and just quite present throughout different life phases and stages. This can also be, or this experience can also be lifelong or acquired. So you may have had it for as long as you can remember, or it might be something that's only really reared itself, for example, in the postpartum period, or after a certain life experience, or as you are reaching peri or post-menopause. Then you might start to feel as though these symptoms are now of concern. Okie dokie. So as I mentioned, you would need to have about 3 of those for at least 6 months, as well as a few other considerations in that. But you might have only one of these and be significantly distressed by that. And that still kind of highlights your need to work with someone. So I'll say it a million times over, please work with individuals that are dedicated to this field. Okie dokes. So I'm going to cover a couple of concepts to help to lay down the foundation of really understanding where you might want to lean in or pay a little bit more attention or bring certain things to your healthcare provider when you're chatting about such things. So the first one is the idea of sex drive. So you've got a drive now to eat, to sleep, to breathe, to drink. If you don't do these things, you will most likely die. If you don't have sex, you will not die. So we try and move away from this idea of sex as a drive and rather think of it more as a motivation. And Karen Gurney outlines this really amazingly in her book, which is called Mind the Gap. So I'm going to use a little explanation here to help to outline this. If I gave you a meal every single day, same meal, same quantities, same texture, same taste, and you did not like this meal, you did not like the taste, the texture, it gave you stomach ache, so it gave you pain. It made you feel not so good. Would you feel motivated to have that meal again? I wouldn't think so. So now if we think about sex, if it's not pleasurable, if it gives you pain, if it's not ticking the boxes of your sexual satisfaction, if it's not doing these things for you, are you going to feel motivated in order to engage in that? So this might be in itself the issue that you are experiencing. You might just not be having sex that's worth desiring. And that might be why you're now sitting with low motivation. So a point to talk about, to think about, to reflect on, and potentially also bring to a healthcare provider if you're working with one. Then I want to speak about the human sexual response cycle. So it's really good to kind of know and understand different responses that occur in an intimate environment, whether it's solo or with a partner or partners. So this was kind of born, if you could say that, in 1966 by Masters and Johnson, and then later in 1977, adapted by Kaplan, where she included desire. And if you kind of look at a more linear model, and that's what this is, you would first experience desire, and then arousal, and then a plateau, and then orgasm, and then resolution or refractory period. This was seen to be really helpful because it helped to identify different areas of responses that might be the problem. And you might say, okay, I don't have a problem with it all. I've only got a problem with a certain portion of it. Let's focus on that. But Besson came in 2000 and helped to expand this a little bit and kind of termed it a more circular model, considering that context, considering a more female, in inverted commas, perspective, identifying that there's spontaneous desire, responsive desire, and there's different receptivity and willingness to engage and lean into this model or these responses. So she really started to consider a little bit more holistically. I believe that we can expect to continue to see an elaboration, an expansion of this as we move away from the biomedical model and further into a more biopsychosocial approach. And we will potentially continue to expand on this as we investigate and explore things such as the neural, endocrine, and immune system on our everything, really. But we'll probably see this coming into human sexual response cycles as well. You just heard me speak about spontaneous and responsive desire. So I'm going to stop there for a moment to just give you a little bit of information about that because it's pretty cool. So spontaneous desire is more something that you would have potentially come across in the sense that it's kind of like horny out of the blue. So an individual just feels, oh, randomly, I want sex. But many would argue this and say, spontaneous desire doesn't actually exist because there always has to be some kind of trigger, that being a sexually relevant stimulus in order to get someone feeling any level of desire. It's just that some people require a lot more sexually relevant stimuli, and some people are really sensitive to the slightest little bit of sexually relevant stimuli. So then we get these kind of two different sides of the spectrum. People that require little and are also very sensitive to that stimuli, and they would be the more in inverted commas, spontaneous desire, horny out of the blue individuals, versus someone that would be thought of as having responsive desire. So they need the perfect context. They need a lot of sexually relevant stimuli, the lighting, the mood, the music, the temperature of the room, etc., to get them really feeling like, oh, okay, 15 minutes in, 20 minutes in, okay, now I want this. I've got that responsive desire. And no matter which one you've got, you're not broken. You're absolutely normal. It's just that media kind of focuses on, and often visual media, that being porn, the more kind of old school porn. And yes, that's absolutely changing with more ethical porn. Those kind of focus more on the spontaneous horny out of the blue and have not really given enough attention to the other normal variant of this, which is responsive desire. So you're not broken. And within a relationship, it's very likely that you will experience desire discrepancy. So one person might be on one side of the spectrum and the other person might be on the other. That is normal and that is okay. Sometimes there just needs to be a little bit of work done, either on your own or with professionals, in order to help to understand this difference and work with it to your advantage. So desire is contextual, as I've said. So we sometimes need to create this context to help to kind of serve the more responsive desire individuals. So I'm just going to stop and make a little tool, just mention a little tool here that you might find helpful. And that is first identifying what is that sexually relevant stimuli? What is it that you like, you enjoy, you've benefited from in the past? You might make a list of previous intimate engagements where there was things that you just love, that just work for you. Make a list of those and see if you can potentially bring those into your relationship a little bit more. And you might also just pay attention. Is there any avoidant behavior going on? How receptive are you to these cues, these sexually relevant cues that might be coming across your way? So, for example, in individuals that are experiencing pain, they might subconsciously move away or avoid being touched or being kissed or being, intimately cuddled with a partner because they might be expecting, or they're thinking in their head, this is going to end up being penetrative intercourse, and that's painful, and I know it's painful, and I would actually just rather avoid this at all costs. So this individual might subconsciously on the daily be actually avoiding and diverting away from these sexually relevant cues, and therefore they require more and more and more, and they're becoming less and less sensitive to these cues that are out there. So really identifying what is it that works for you, and then reflecting on how sensitive or how avoidant you might be to these cues. The next thing two things. Let me speak about two more things before we move on to a whole bunch of tools. So the next one is something that was explained beautifully by Emily Nagoski in her book called Come As You Are. And this is the dual control model. Here we speak about a car in her book. So I'm going to use that because she just did an incredible job and she is amazing and her analogies are just perfect. So we are going to go with that because it makes sense. So we're going to talk about an accelerator, that being your sexual excitatory system, as well as all the things that turn you on, as well as your brakes. So your brakes is your sexual inhibition system, and this is all the things that turn you off. So now think of this car. If you are sitting in the car and your foot is flat on the brakes, it doesn't matter how much you push on that accelerator, the car's not going anywhere. So if there are things in your day that are constantly pushing on your brakes, It doesn't matter how perfect that context is. It doesn't matter how much sexually relevant stimuli comes your way. You're most likely not going to feel a sense of arousal or desire that comes up with this stimuli. A tool that might come from this: listing the breaks, listing the turn-offs, figuring out what those are, listing your accelerators, the things that turn you on, figuring out how we can push into those. And if you were to be working on your own or with a partner, you might first focus, how can I take my foot off of the brake before we actually start to feel the effects of the accelerator? So reflecting, writing down, taking the time to really identify what these are, acknowledge them, give them some credit, and then making the adaptations that need to happen, that need to occur in order to help you to really feel the effects of that accelerator. Next, let's talk about arousal non-concordance, because I really like the theory that comes along with this. So this is essentially, in a summary, your brain and your body and how they communicate and align. Arousal does not just occur in your vulva. It occurs everywhere. It's all over you. Your brain is an incredibly powerful sex organ. You might notice changes in your skin as your hair stands on edge, areola changes, respiratory changes, heart rate changes. Vaginal lubrication might increase. Your pelvic floor might relax. Arousal is everywhere. It's a full body experience. Now, with arousal non-concordance, this is when your brain, you might be feeling and thinking of very erotic things and be feeling very aroused, but your body doesn't quite listen or follow suit. So you might then be feeling like there's no vaginal lubrication, or your pelvic floor is not very relaxed, which together can combine to cause a little bit of painful penetration with a bit of friction and discomfort. So please use lube. It can also occur in the opposite way around. So that would be that you are feeling vaginal lubrication, but you're not really feeling aroused. So it just feels like it's a bit of a mismatch. Why is this occurring? Someone might say to you, "Oh, you're very turned on." And you're thinking, well, no, I'm not. I'm actually just really not into this. I'd rather go to bed. And both of these are normal, right? There's lots that we can do to work on this, but you are not broken. So the theory that I really like that comes alongside this is twofold. Number one, individuals with penile anatomy, they might have this connectedness and this alignment of brain and body more so than individuals with vulvovaginal anatomy. So hear me out here. Individuals with penile anatomy might have, as they're growing up, number one, been encouraged to engage in their sexual self, been encouraged to explore themselves, not being pushed away from such things, such as those with vulvovaginal anatomy. Those individuals might have been told, keep your legs closed, don't look at your vulva, don't explore your vulva, don't touch it, don't talk about it. You are on this world, you're on this planet for reproduction and reproduction only, and you must only become a pleasure-driven being when you are married. And that can influence us as we age. We can't all of a sudden just flick the switch and now I am a pleasure-driven individual after being told forever that I'm not. So this can influence the relationship or this connection between your brain and your body. Second fold is about positive feedback. So someone with penile anatomy might have grown up seeing sexually relevant stimuli on the TV or out in the world, and that they might have felt in their brain aroused, looked down, seen an erection, and made that association. Ooh, these two things go together. Whereas an individual with vulvovaginal anatomy might have seen something sexually relevant, straight away thought, oh my gosh, I'm not allowed to be exposed to this. This is bad, move away. As well as being exposed to this, felt mentally aroused, potentially, and looked down, and they don't exactly have this overt, engorged penis to look down to create that positive feedback, to create this association with my body and my brain and my genitals and my brain, and feeling like these two things are connected. So a very cool kind of theory that goes alongside why individuals with vulvovaginal anatomy might be experiencing this more so than individuals with penile anatomy. And please just keep in mind it's just a theory. All right, so after going through a couple of foundations, and this is by no means comprehensive, this is the tip of the iceberg, and these are just things that I've learned from my incredible colleagues and from books and podcasts that I feel have been incredibly valuable. So I thought I would share these little snippets here, share them with you so that you can use them in practice or in your personal lives, and also have these cues to chat to professionals. Okay, so what exactly can you do with this information that I have now given you? Number one, and I'll say it again, and you're going to be annoyed, that is work with a professional. Pick up the phone, use the confidence and the knowledge that you have gained from today, and just do it. You deserve it. This is not an advertisement for a certain sports gear brand. Okay, so that's number one. Number two, determine what you want. What exactly are you striving for? What exactly are you trying to work towards? So take some time, go through the details and really kind of dig deeper. What is the sexual satisfaction that I am working towards? What is the lighting? What is the type of touch that I am looking for? What type of lube do I like? Do I want to use devices or do I not? Go into the details, reflect on these, determine what do you want? What are you actually working for? Because we know that frequency, i.e., I want to have sex 3 times a week because that's what I read in a magazine, that is not reflective of sexual satisfaction. Neither is the number of orgasms that you can have, right? It's more than that. It's deeper than that. It's connection. It's intimacy. It is so much bigger. So start to reflect on what it is that you want. Okay. Then get to know yourself. What turns you on? What works for you? What are you struggling with? Can you do something about that? Is it body image? Because we know that body image negatively influences desire and arousal. So can you create that space for yourself? Because so often we don't do much for ourselves. Can we create that space, work with someone, and potentially work on something such as body image? Can we work with someone such as a coach that works in the field of helping individuals lean into their sexuality and really try and figure out what is it that I like? Is it light touch? Is it firm touch? Is it kink? Is it soft music? Is it satin on my skin? What is it that I like? Get to know that about you so that you can indulge in that on a personal basis or with partner or partners. Then the next thing is be patient, willing, and ready to put in the work. I use the example of running a marathon here. You would never just arrive at the start line and expect to be really, really good and win that race. You would probably have had to work with professionals, put time, put effort, put endurance into that training, really, really indulge yourself in it in order to finish that, win that, be good at that, feel good about it. So liken this to sex now. We need to be willing to put in that work to get us there. That might take communication, compromise, being curious about unknown, taking turns to initiate, potentially scheduling sex. And if that's too much pressure, because at the end of the day, you're just thinking, oh my gosh, I've got to go home and I've got to do this. If that's too much pressure for you for now, maybe you can just schedule intimacy. But they should both have the same priority for you and your partner. Can you invest in what feels good for you, invest in what you feel is working, and just continue to do so as you progress? Next, communication. So there are different types of communication within the relationship, with yourself, with a partner, with a professional that you might want to lean into. But if we're specifically talking about communication with a partner, I want to cover 2 things that are usually quite helpful. And number one is pillow talk. So pillow talk is that positive feedback that you do in the bed, in the bedroom. I loved it when this happened. I loved it when you did this. That really made me feel good. Using that positive reinforcement to get more of that good stuff, that good meal we spoke about earlier. The other is coffee table talk. We have serious conversations about finances, about legal matters, about politics at a coffee table. We don't do it in our intimate bedroom, right? We do it separate from that because this is serious. Talking about your sexual health is serious, and we need to take it seriously and have those conversations in the correct context so that we can work through them. So that would be the coffee table talk, talking about your expectations, the difference between sex and intimacy. What is sex for you? What is sex for you in this relationship? To help you to work through that. Then the next is lube. So if you know me, you know that I am a fan of lube, and I believe that we should be using good quality lube from a reputable source. So on my Instagram page called Nurture Your Vagina, yes, you heard that right, there is a guide called Lube, and in that you'll find details about osmolality and pH and things to consider, what to do, what not to do, different types of lube, etc., that I would like you to kind of lean into because it is important. I don't want you putting, cinnamon scented glitter burny sensation nonsense in your eyes or in your mouth, and I definitely wouldn't want you to be putting that in your vagina, or on your vulva. So let's use the good stuff. Okay, so then the next one would be heart rate variability. So as we're moving through those human sexual responses, we are shifting between sympathetic, parasympathetic, sympathetic, parasympathetic, that take us through, for example, the plateau would be more parasympathetic. Then the orgasm would be more sympathetic. And then going to resolution would be more parasympathetic again. And we need to have this capacity to shift. And all too often we are stuck in the sympathetic. We're stuck in the survival mode. We're stuck being busy, being distracted, thinking about 30,000 things at once. And that makes it difficult for us to shift and move into this more receptive behavior when we are engaging with a partner intimately and when we're moving through those human sexual responses. So can we potentially improve this kind of ability to move? They call it your autonomic tone. Can we improve that autonomic tone by working on heart rate variability? So this would be doing activities such as high intensity interval training. And most of us are very familiar with this type of training because we are used to being in that upregulated survival, busy mode. But also practicing the other side of the spectrum. So that might be yoga, meditation, long, slow walks, not marching, doing, visual and audible kind of meditative work when you sit and you stare at the ocean and just feel kind of consumed by the smells, this different senses that are coming your way, really allowing your heart rate to be a lot lower. So being really good at shifting from one side to the other can then almost help us practice having this good shifting ability. And then in an intimate encounter, so in our human sexual responses, we have a better ability to shift back and forth there too. The last thing I want to speak about is curiosity. So being curious about the unknown, being curious about the things that you might have brushed under the rug as you've explored your sexuality because you felt that it is not okay because society has told you that it's not okay. So being curious about these things and leaning in. You might start a little bit more simply, things that are less intimidating. It might be erotic audio, such as that by Guided by Glow, and using that to help to stimulate the sexually relevant as a sexually relevant stimuli, and then slowly moving towards more visual cues. It might be first line drawings, cartoon drawings, still pictures, and then slowly working towards more motion pictures and things that are a little bit more realistic to help to stimulate. You might think or explore about pleasure aids that might be devices such as vibrators or rings. With this, I always encourage individuals to reflect, think, how does this make me feel? Why does it make me feel like that? What are my meta emotions? You might be feeling a bit irritable. And then how do you feel about being irritable? Am I angry with myself? Am I frustrated with myself because I'm irritable about this, because I'm scared of this, because I'm avoidant of this? Can you work through this? Can you speak to someone about it? What can we do to help you to explore that curiosity a little bit more with a lot less shame? So, those are the tips. We've spoken about working with a professional, determining what you want, getting to know yourself, being patient and willing to put in the work, communication, lube, heart rate variability, and your autonomic nervous system, as well as curiosity. Whew, this is a juicy topic. There's a lot to it. It's a big topic. And this, as I said, is really scraping the surface, but can really make a world of difference with regards to knowing and understanding where you are and what it is that you can work on. So I often say, you don't know what you don't know. So if you don't know that arousal non-concordance is a thing, or that there is this dual control model, or that you can have responsive desire and you are totally normal, then we often sit with frustration or shame or wonder, why do I not look exactly like my partner, for example? My hope is that this conversation eases anxiety regarding libido, increases confidence and comfort and communication, as well as piques your curiosity, getting you to the point where you can give yourself the space that you need to lean in and get curious about without judgment and expectation. A little bit of education can really go a long way, providing validation, easing anxiety, diminishing catastrophization, and helping you with problem solving. So I really hope that this episode has done exactly that for you. Please remember to seek help when you need it. As always, with love, thanks for chatting with me today and listening about low libido, or FSIAD, but low libido will do. Okay, bye. Well, NurturePod listeners, until next time, please review and subscribe, and as always, stay curious. As a special treat for listening to today's episode, you can head over to the nurturepelvichealth.com website and use the code NurturePod for a 20% discount on all pelvic and sexual health courses. And now, let's indulge in a gift from Guided by Glow, whose mission it is to create a transformational practice of awakening your sensual feeling body, igniting your imagination, and cultivating a positive and thriving sexual relationship with yourself. Try today and take $20 off your annual membership using promo code NURTURE. Go to guidedbyglow.com or find it in the App Store.